All right. So I just want to welcome you guys here. Just hoping that people will join us. And if not, we're going to be posting a recording of this little chat up on our website for people to see. And yeah, so Kim, I'm just wondering if you want to say the disclaimer or read the acknowledgement that we have.
Yeah, so I just want to take a moment to acknowledge that the CHNA represents nurses from coast to coast to coast and acknowledges the ancestral territories of all Indigenous peoples of this country. And as the CHNA pledges to uphold and uplift the voice and values of our nurses, so do we pledge our commitment to upholding healthy relationships, ethics, protocols, and traditional knowledge and cultural practices that reflect and pay tribute to the truth and reconciliation calls to action. Just welcoming everyone to this space, and just as another disclaimer that as Kate mentioned, this video is being recorded, so it will be used for educational purposes. And if you don't want your video on, this would be a great time to turn it off. Otherwise, your video may be displayed. So just to be aware of that. And today is just further discussion around, you know, kind of what we've been up to this year and where we're heading in 2023. So we're really looking forward to just connecting with you guys and sharing a little bit about the past year and what we're doing to move forward into the new year.
Awesome. Thanks, Kim. So I was just thinking we would introduce ourselves. I'll start. I'm Kate Celeste, and I'm the president currently of the CHNA. I'm in Vancouver, and I've been with the CHNA off and on over the past 5 years. And I'm just really excited with the work that everyone's been doing and the group of nurses who have come together to represent holistic nursing in Canada. It's a very exciting time. So yeah, so that's me. So maybe Kim, do you want to go next?
Sure. I'm Kim Durkach and I'm in Saskatoon. So as Kate mentioned, just it's so lovely to be here with everyone and like-minded and like-hearted nurses. Really excited and passionate about holistic nursing and holistic nurse coaching. And it's just really exciting to see what's blossoming in Canada here specifically. So really looking forward to what's to come and how things are continuing to progress and how the message is spreading and we're seeing our community grow, which is just very exciting. So it's nice to connect with everyone today.
Thanks, Kim. So somebody else want to jump in?
I can.
Sure.
My name is Susan Hagar, and I am currently the Vice President of CHNA, and it's a real delight to work with the board members of CHNA and connect with the members whenever the opportunities present. I run a nursing business in Ottawa, Canada. However, I'm currently located in the Andes Mountains of Peru, and just part of the beautiful thing it can be to be a nurse in independent practice. And I'm just super excited about supporting nurses at a difficult time in nursing. I think no doubt everyone would agree to that. And we know that holistic nursing and holistic practice is key to our to a thriving experience of life and our nursing practice. So nice to be here with all of you. Thank you.
Thanks, Susan. Sherry, do you want to go?
There we go. Hello, I'm Sherry Hole and really happy to be here with everybody today as well. I've been with CHNA since 2015 in various capacities. Right now I am the standards officer. So I look after keeping our standards up to date and renewing those on a regular basis. Yeah, really happy to be here and be a part of this wonderful group of nurses and to really watch and witness how nurses are finding their way back to their true selves. You know, themselves as human beings, but also themselves as holistic nurses, because that's really the foundation of what our nursing profession really is all about. So to see the growing interest is just so encouraging and wonderful. And yeah, I'm just very grateful to be here with this wonderful group today. Thank
Thanks,
you.
Cheryl. Jocelyn, do you want to say something?
Yes. Hi, good morning, everyone. I'm Jocelyn Oksena from Manitoba. Um, the background of Kate is my background right now. Lots of snow. But anyways, yeah, so I'm one of the board of directors here in CHNA, and I'm so excited to be part of it. I think what everyone is saying about the situation of healthcare right now, I think we look at it in a positive way, in which like I think it takes a big fall for everyone to stand up, and this is an opportunity, a paradigm shift, that people are seeing the importance of integrative, complementary, and alternative health, and that's what we're here for. So I'm really excited about the future of holistic nursing. Okay, thank you, everyone.
Thanks, Jocelyn. And Lauren?
Hi, I'm Lauren. I'm from Ottawa, and I am a movement and mindset coach, as well as I work with Susan with her business. And it's been such a joy and passion. And I'm on the board of directors for almost a year now, running kind of the social media side a bit, which has been awesome. And it's just amazing amongst everything that's been going on in healthcare to be part of something that is truly going back to what the foundation of what nursing is, and just finding that growth and finding, you know, like-minded women and people wanting to grow their nursing in such a positive way, in such a grounded way. So it's been awesome to be part of this movement and this community. So yeah.
Thanks, Lauren. And I know Meg is just a little busy right now, but Meg is our treasurer and doing a fine job at that. So when she comes back, maybe she can take a moment and just introduce herself, but that's just fine. So this today was intended just to touch base with the members and the public, whether they could attend this webinar in person or not. It will be posted on our website, and I will also make sure that it's sent off to people who weren't able to participate today. So we just wanted to get together and talk about some of the things that we've done this year, what our goals are for next year, and some ideas that we have to reach those goals. And also, I really wanted to reach out to everybody to get your feedback, if not today, through our email, which we'll give you at the end of the presentation, just to get an idea of how we can help you. You know, what can we do to help you on your holistic journey? Whether you are moving into a holistic practice or just curious about what holistic nursing actually means. If you're a member of the public and you're wondering how to access these types of services, it really helps us to know what you need, because we can search out presentations, theory, information for you and give you that, you know, real time. So please feel free to reach out to us with any of your questions around holistic nursing and what's happening in Canada right now. So I think I'm just going to go over our mission and vision very briefly, just to get us focused. So the mission of the CHNA is to support the practice of holistic nursing across Canada by acting as a body of knowledge for its practitioners, by advocating with policymakers and provincial regulatory bodies, and by educating Canadians on the benefits of complementary and integrative healthcare. And our vision is that complementary and integrative healthcare are incorporated into all aspects of nursing and the patient care experience within the Canadian healthcare system. So just small little things. But I'm getting the feeling, and anybody else, please pop in and add comments. But it's been my experience recently that there has been a real swell of nurses who are very interested in participating in this paradigm shift. So what has your experiences been with that?
I think so too, Kate. We're seeing a lot at the Kind, a lot of inquiries, a lot of nurses coming forward and saying, oh my God, I can't believe that there are other nurses out there that feel the same way I do. And, they often go back to the, how they felt or what their expectations were when they first came to nursing or when they first became a nurse, and how it wasn't what they envisioned that it would be, and that this is really what they expected nursing to be, that, you know, that real caring, having presence, you know, helping individuals learn what healing means for them and how to tap into those innate abilities. But what I'm finding is, I don't know that it's really all that new for nurses. I think it's the support that they're feeling, knowing that they're not the only one. So I think, you know, I think that interest has always been there. It's just something that's been kind of hidden or tucked away in most of us. Because when we talked about it, especially, you know, years down the road, I know in my own personal experience, it was always kind of looked at like, are you kidding me? Like, you know, holistic nursing is kind of woo-woo. We're supposed to be evidence-based and science-based and whatnot. So I think they're realizing now that we are, and it is, and the practice of holistic nursing truly is evidence-based practice in the truest sense. So, but I also think, to add to that, you know, people are realizing, the general public are realizing too, that it's not all just about medications, right? There is a place for medication. There's a place for medicine, and we don't dispute that. But people are looking for more holistic ways and more wholesome ways to look after themselves. So I think the demand as well is coming from the general public. And nurses are realizing, hey, we're the best ones to step in and work with you. Yeah.
Yeah. And I have to agree with a lot, with pretty much everything that you said, Sherry. Absolutely. So, and as I'm listening to you speak about that, the question comes to mind, what is a holistic nurse? And I'm going to put Kim on the spot. What's a holistic nurse, Kim? Why is it any different from what I'm doing already and working in the hospital?
Yeah. And, you know, a holistic nurse, it truly is the embodiment of a way of being. So often we're so used to, you know, thinking of like things we can do, and it really is embracing this new essence and this way of being. And it's something that not only comes out in our nursing career, but it's often who we are at our core and how we embody that. And so we can model these aspects within, you know, our personal life, and we model this to the people that we work with, our friends, our family, our coworkers, our clients, community members. So it really is a way of how we embrace, right? We look at the whole self, looking at all aspects of the mind, the body, the spirit, the emotions, relationships, our environment, internal, external. We're really looking at the whole self and ensuring that we're incorporating that self-care, which is different for everyone. You know, it's unique, and we're embodying all these pillars of health that really lead us to living a life that feels full and vibrant to each individual, and knowing that, you know, we're worthy of that health. And we want to make that, as holistic nurses, something that's accessible to everyone, because this is truly accessible to everyone, health in all of these levels. And so education and having the knowledge out there for individuals is so important. It's imperative, because it's accessible for everyone. We want it to be accessible for everyone, and we want everyone to tap into that innate wisdom of their own being and how they can tap into their own healing and understand what that means for them, because it's going to be unique for each person.
Absolutely. Thank you for that.
Yeah.
So when you think about our colleagues who are working in the allopathic system, so, and I don't always like to categorize it, but the ones who are working diligently and hard in the hospitals, in the clinics, in the health authorities across Canada, you know, a lot of them will say, well, who has the time? I don't have the time to learn this. How can I even take this type of a perspective into my practice in the hospital? And realistically, it is difficult when you think about it, you know, at face value. But it's been my experience that through, you know, practice and education of myself and mentorship from other people, that even bit by bit, taking a moment for yourself, capital S, you know, connecting to what guides you, connecting to your higher source, you know, that's a choice for us to do that. But as we practice doing that, and viewing ourselves in a physical, emotional, mental, and spiritual way, you know, it just sort of, it comes with us to where we're practicing. So I think that a lot of people do struggle with, how do I take this paradigm and apply it to what I'm doing right now? Because not everybody wants to leave their jobs. These are just other tools to support them. So does anyone want to speak to that type of a journey?
Can I say something?
Yes, please.
I'm part of the health and wellness committee at my workplace, and so it's led by the human resources and stuff like that. So they're asking for our opinion as to what we can do to engage staff, and of course they realize about the burnout and workload and all those things. So they are open. Human resources, the institution are open to anything that would empower and help these staff. So what I've suggested, and actually they approved right away, were like self-help tools like that. We can do like a 15-20 minutes lunch and learn kind of thing. So like a little bit, just for a few minutes, talk about like a few acupoints kind of thing that you can do when you're having headache or stress, and or the importance of sleep and so on. So I'm glad that they are opening to that and recognizing that staff needs this as well. So, yeah, so
Yeah, I think that's so important, Jocelyn. And just even to build on that, I think that's one of the things that we're seeing too, is not only, as we've mentioned, is there increased interest in holistic nursing, and as Sherry mentioned as well, increased, community and people feeling like they have, a place to go to discuss holistic nursing and demand from the public. But we have also seen organizations, as you mentioned, be more interested in offering holistic ways to help their staff, nursing staff, within the health and wellness, arena, so to speak, right? So we're seeing more and more open-mindedness, so willing to view things differently. I think the pandemic exposed a lot of cracks that were already there and exacerbated some. So I think there are organizations that are looking for new and innovative ways, and they see the value of holistic approaches to care. And the clients are also kind of, inquiring and desiring this type of care and health and wellness as well. So I really see the whole shift, the whole paradigm shifting at this time. And it's exciting. It brings, I think, hope is what it feels like to myself and to other nurses and to, our healthcare system at large, that, we can start to bring these modalities, this knowledge that's been around for a long time, but bring it to the forefront as our tools and as uses that can actually enhance our health.
I'd like to go back to something Kim had shared a little while ago as well, when we talk about organizations doing things to help with self-care and that they're open to it. That's wonderful, and lunch and learns are wonderful and all that, because the education piece is really huge. But one of the things I think that we really have come to appreciate over the last couple of years, like even in just teaching our program, is the value of really embodying that way of being every minute of the day, and how holistic nursing is, yes, a way of providing nursing. It's a way of being with our clients, but it's just as much about the nurse. And I feel extremely passionate about that. Even my involvement with CHNA, I think our message really, is focused on the nurse as well. That how can the nurse embody a holistic way of being? How can we, through every moment of our day, regardless of what we're doing, whether we're inserting a catheter or we're doing charting, or, like you said, Kate, we have people at the bedside. We need nurses at the bedside. We don't want them all leaving and going out into the community, So how can how can we guide these nurses in learning ways that they can be whole all the time? You know, so it could be our breath when we're doing our charting, like tuning into that, tuning into our inner dialogue. You know, what is our posture like, you know, as we're sitting there doing our charting? What, you know, what are we thinking? How are we being? How are we walking from one bedside to the other? You know, because I know I worked in the hospital for years, and I know I was often in, it was almost like I was in overdrive from one bed to the other, right? And it was just, okay, I got to do this next. I got to do this next. It's still going to take the same amount of time to get from one bedside to the other. So that's an amazing time to take a few good, deep, nourishing breaths, you know, get some oxygen going in your body. Bring yourself into that space, be mindful. Anyway, I could go on and on because it's definitely a passion of mine, but
That's okay.
yeah, I just really, I'm seeing it as we're working with nurses and students, that it's just a completely new way of being that they've never really considered before. Not all of them, but most of the students that come to us to learn holistic nursing. Yeah. It's
Yeah.
like, wow, I never thought of practicing this way before.
Mhm.
You know. Yeah.
And even getting the concept that this could help you in
Yeah.
how you're feeling and your own health, and protect you, you know, while you are working in,
Yeah.
you know, crazy environments, difficult situations, you know, trauma, vicarious trauma, everything that we pick up. So, you know, what I think CHNA is trying to do is at least tweak an interest in the nurses who are working now, and then, you know, provide the resources that people can plug into to start to learn about this at their own pace, you know, at their own pace, because it takes an experience of your own to really understand holistic.
Yeah. Mm-hmm.
And to really embrace it and take it forward. And it's, you know, I maybe 10 years ago, I didn't know necessarily what holistic was. I think nurses, essentially, we assess our clients, you know, in a full circle, but a lot of times now we just run out of time. We do the best we can. So I think essentially we know how to be a holistic practitioner, but we don't necessarily have the luxury of doing that.
I think too, we've heard the talk in our training. It's been, you know, we are holistic practitioners. We do holistic assessments, but have we really been trained to take that holistic perspective to the bedside in our actual practice? You know, have we learned how to use it in our own lives to be healthy, wholesome nurses for ourselves first, and then our clients? Anyway, okay.
Jocelyn. It's fine. Go ahead.
Yeah. Actually, this is very interesting because taking holistic nursing to the bedside, for me as an occupational health, is like taking holistic nursing to the workers. So as I am working with my requirement for the kind, actually, doing the presenting myself as a holistic nurse coach, a lot of things just keeps on coming up to me that, you know, I can do this, I can do that, I can add on to this kind of thing. And I'm having a hard time putting it on because there's just so much information that keeps on coming to my head. But you know, this is really like, you know, knowing that nurses and other healthcare providers know what they're supposed to be doing, but because they're too busy taking care of other people, that they cannot stop and do their own medicine kind of thing for themselves. And being holistic nurse and facilitator of the journey in healing, that's what we're trying to do for them. They know what to do, but we facilitate it for them because they tend to forget what they need to do. They need to stop, smell the roses, maybe have a better sleep, do some meditation, or all those things that I've learned from the kind. That's, this is the thing for me, like having workforce as my patients, as my clients. Some of them doesn't want to be told. They don't need a consultant. They need a coach. And that's what holistic nurse coaching and would be perfect for me as an occupational health nurse for healthcare providers. So I'm so excited about that. And just giving an example for me, because I was so focused on helping other people that my own health issues, including my sleep, has been altered. I have severe sleep issues that I don't get a deep sleep. And recently, because I've been focusing on that for over 19 years, I haven't had a dream. It means to say I have not been deep sleeping. I wear a mask for sleeping. And recently, for the past month, I've been dreaming every day that I thought, okay, enough with this dream, But because of that, I've been having a better sleep, a healthier sleep, that I felt my old self again. So these are the things that we tend to forget. And we need to just remind people that this are holistic caring for our health kind of thing. So anyways, I'm just so excited about it, and really it's going back to the simple ways. These are simple ways that people, is like basic stuff that we tend to forget. So yeah, so I'm excited. Thank you.
That's awesome, Jocelyn. Awesome, Jocelyn. Thank you for sharing that. And it's a good example of how, different things for different people are so important. The approach for one person won't necessarily be the same for another. But it's sort of based on the same principles, right? Body, mind, spirit, physical, emotional, mental, spiritual. So, if one of those things is out of whack, the other three are going to suffer. So where do you even start with that? And with the CHNA, we've got some ideas and some resources that hopefully are going to be helpful for nurses who are already practicing, but also for students. So one of our goals has been to reach out to nursing schools, and with the goal of introducing holistic nursing concepts and how they can be applied for yourself as self-care, how they can be integrated perhaps into their nursing theory that they're learning right now, and learning it as a student so that they can feel comfortable with it as they move forward in their practice. It's not going to be a foreign discussion for them. So what we did this fall is we were actually invited to participate in a launch. It was like a convention for kids who were graduating, like grade 12s, looking like a job fair. And so we had a virtual booth with information about the CHNA. And we also responded to their questions. So at that time, I think Susan and I were manning the booth and answering the questions. And I believe we had more than 1,200 visitors. Susan was more aware of what the stats were after that. Susan, are you able to speak to that just a little bit?
Yeah, that's right, Kate. We had a huge numbers of visitors, lots of questions. I think you and I answered some, 55 or 60 questions from the students. So they were really engaged and interested, and it was a worthwhile use of our time.
Absolutely. It was exciting, and really, really good questions, really thoughtful. And then we were again invited to participate in another one. It would have been this week, but we just didn't have the time to do it. And it was an on-site one. And, because we're a national group, we're not always available locally, but it was great to know that people are aware of us now. And also in February, we're going to be having a webinar specifically for students. And one of our members is going to participate. She's a nurse educator out here in British Columbia, Linda Shea. And Kim, we're going to host that in February. So that's going to be, we haven't quite decided how we're going to invite people to that, but that will happen. We're hoping to have nursing students from wherever they want to come from, right across Canada to sit in on this, to start the conversation. And then educating nurses who are already in their own practice or in practice, you know, in hospitals, etc. If you look on our website, www.chna.ca, I believe it's under About, the About tab, there is a list of nurse theorists who have really molded holistic nursing practice. If you would like or are curious to find out more about nursing, holistic nursing theory, take a look at them. I think one of our goals for next year is to expand on those theories and actually, you know, do a synopsis on each one and post that so that, you know, it's right there for you to take a look at. We've actually got a webinar posted already in our members area with an interview with Barbara Dossie, who I think, Sherry, could you speak to Barbara's work?
Yeah. Oh, yeah. I'm already unmuted. Yeah, we follow at the Canadian Institute of Integrative Nursing Development and Education, where we teach a holistic nursing and nurse coaching program. Our teachings are very much focused in the teachings of Barbara Dossie and Dr. Jean Watson. So Barbara Dossie is very much about, you know, caring and presence. And she is actually one of the gurus for nurse coaching, but definitely holistic nurse coaching. So bringing that element in as well. Maybe Kim, you can speak about, because I'm not really too familiar with this, but the global initiative that she is involved in with, is it DIVA, I believe? Oh, you're muted.
Thank you. Yeah, Diva Marie Beck. So they have a global health initiative through the NIE. So it's like the Nightingale Initiative for Global Health. And that's a big focus of theirs right now. And you can go on the website to learn a little bit more, but that's an initiative we are involved in at the Kind. We've written a story, and each anyone can write a story and kind of share how they're supporting to global health. And as holistic nurses, I really feel like we're all supporting healthy, you know, we all want healthy individuals, healthy communities, and a healthy planet, right? It's all interconnected. And so that's why we're so passionate about that and the work that she's doing as well, because it's a very holistic approach. And obviously everything weaves into one another. So that's also something that she's involved in.
Yeah.
Thanks.
Sherry, we do have a date for February.
I think it's, was it the 7th?
Yes, it's February 7th.
Okay. Yeah. And speaking of the webinars, that information is on our website, the schedule for the webinars. Typically, they are created and posted for members, CHNA members, but we have, as well as with our newsletter, gone public with a few of them, just if it's something that's pertinent to public information. Things that we feel would be very beneficial for those even non-members, we do post them with accessibility for you guys. So while we do like to have our membership perks, I guess, to create that community too, we do understand that, you know, we're not going to reach anybody if we don't share. So yeah, it's important to us too to do that. So maybe just to touch on our goals for 2023, I posted them here in the chat thing. So to increase our social media presence has been very well supported by Lauren. Lauren's been great in starting our Instagram page, and we have a LinkedIn, and we have 2 Facebook pages, one for our members community and one for the public. And our website was updated about a year ago or so, and it continues to be our main hub of communication. Feel free to go and take a look at all the pages. You can contact us through info@chna.ca. You will be responded to by one of us, and any questions that you might have. The other, let's see what's next, increase our membership and membership support. So we have 4 different membership options. We have the CHNA exclusive, we call that. And we have a international chapter. We are an international chapter member of the American Holistic Nurses Association. There are a couple of different things that you will get from that type of a membership. And I think the most, the one that people focus on the most is the Journal of Holistic Nursing and the Beginnings magazine that you get via subscription. And the Journal of Holistic Nursing is a research-based, peer-reviewed collection of articles and research, which I found extremely beneficial when I was doing my master's. Really interesting work. So that's one benefit of the AHNA membership. We've also got a student and a retired nurse membership that's available. So take a look at that if you're interested. If you have any questions, again, just reach out to us about that. As we spoke about increasing student nurse engagement. So we really are going to try to reach out to schools and groups of students, student organizations, and just start educating about holistic nursing practice, because it would be really nice if, you know, CHNA was a go-to through the spectrum of somebody's nursing career. You know, you don't have to be in an independent holistic nursing practice to be a holistic nurse. So no matter where you're practicing, we can be there for you to help you either with your own self-care, you know, or to help support you in integrating your those concepts into what you're doing. And presentations to groups and associations, we're always available. If somebody wants us to come and speak to a group, we can do it virtually through Zoom or what have you, and mentorship opportunities. The majority, I would say, of the majority of the emails that we get are typically around, what do you do? What is holistic nursing? And what does that look like? And, you know, and also around spirituality, because automatically it seems that when someone says, you know, that word, that term, they will go to religion, formal religion. And it can be that for sure. But for some people, it's being a spiritual person. It's whatever feeds their soul. It's whatever feeds their heart. You know, and maybe others can you talk about spirituality? Maybe a bit of a definition around that to help people understand that a bit more.
Sorry, Kate, my Zoom just cut out.
Okay, I just brought up the term spirituality and spirit. And when we refer to that as part of our holistic nursing practice, sometimes people are confused about that, or just don't understand necessarily the parameters of what that might mean. That it's not just somebody who attends formal religious services.
Yeah, absolutely. And, you know, I think there's, like, as you mentioned here, there can be so much overlap of when someone asks if someone is spiritual, they might identify that with religion, when, you know, spirituality is just so unique. It's kind of like your fingerprint. Everyone's spiritual expression is going to be their unique expression. And so it can really encompass anything that a person might find that piece of themselves in. So some people might find that in nature, connecting with nature is a big one, connecting with self, connecting with others. And, you know, religion might be an aspect of how someone expresses part of their spirituality, but it might not be the case for everyone. So oftentimes, you know, a crisis or something can bring people to their spirituality, but it doesn't always have to be. Sometimes it can be a really enlightening moment where, you know, the birth of a child, or, you know, we kind of think of like the life cycle, the birth of a child, or sometimes the ending of a life cycle, or anything in between where people experience chronic illness, which might also sometimes bring people to holistic nursing in general. So they might start to ask the bigger life questions, the deep rooted question of, you know, what, you know, around the meaning within their life, purpose. And so that's where that exploration can begin, and how we each connect with spirit, or however we might label that term, is going to be very unique. But it's definitely a topic of a big interest, and one that is so important to our health, and often one that isn't understood, as you mentioned. So people can be exploring that. It's a lifelong journey, and it's going to constantly evolve throughout the life. So as holistic nurses, it's really important to know how we can explore that inner peace as we in our own life, so that we're comfortable with, where we sit within our spiritual selves and how we can bring that to the bedside. How do we bring that pillar of health to our clients, to our community members, and to the bedside where we might be working? I know there's the practical aspect where you've mentioned time, Kate, because that's always something we're going to be maybe moving against, but it can be in a 5-second powerful question that might make someone think. So we just never know the impact that it may have, to be able to assess that and to really, kind of almost decrease the stigma around what it is to encompass spiritual health, and to assess for that in our own life and in our professional practice as well.
Well said. Thank you, Kim. Yeah, it's interesting, isn't it? And another way that we sometimes look at our clients through the holistic lens is that you never know necessarily where the healing's going to be. You can be such an effective provider, even in situations where there is no cure physically to be had, in hospice and palliative care, or, but by still being able to use the holistic lens to maybe support those areas that we might not have so much in a different circumstance. There's emotional, again, physical, emotional, mental, and spiritual aspects of self, and all of those exist together. So it's just really nice to be able to just take a breath, take a pause, and really consider all of those aspects of our clients.
Absolutely. And I think you bring out a really valuable point about the difference between healing and curing. And Sherry, go ahead. But
Oh no, I'm like, that's, I want to talk about that.
Yeah, and please add on, because I think within holistic nursing, we use the languaging of healing quite a bit, and we speak to that. But there is a big differentiation between what it means to be on a healing journey versus what being cured is. And I'll let you speak to that, Sherry, because
it's interesting because we're getting ready to send out our Christmas newsletter tomorrow from The Kind, and there's a piece in there where I make a comment about healing, and definitely healing I believe falls under that spiritual realm for sure. But one thing that I've noticed is that healing, the term healing or the word healing is coming up more and more in the community as I'm out and about doing breathwork classes and yoga classes and that sort of thing. But what's a bit disheartening for me is that practitioners, not nurses necessarily, but other practitioners are starting to disregard the word healing or not use the word healing. And the last time that I went to a breathwork session a couple of weeks ago, somebody said, it's such a healing practice. And the practitioner that was doing the session said, well, we don't use the word heal anymore because that insinuates that you're broken. And I want to speak to that for a moment because it's not the first time I heard it. And I just want to clarify that healing is making whole, right? So it's like you said, Kim, it's not curing. Curing can happen during the healing process, obviously, but we can heal right up until we take our last breath. So healing is about becoming whole. It's about integrating that mind, body, spirit, in the sense that we are able to experience optimal health to the best of our ability at any given time, right? So healing is an ongoing, everyday, perpetual journey. Anyway, I just wanted to throw that in there. And for me, that is a very spiritual part of my practice, is engaging in that healing every day. The other thing I jotted down that I just want to mention while we're talking about mind, body, spirit is over the past couple of years, I've really come to appreciate how much environment belongs in that category of mind, body, spirit. So that's a very it's a very internal thing. It's about us as human beings. And when we look at our environment as holistic nurses, our our internal environment is so very important as well, right? So it's how we're looking after our physical being, but also the inner dialogue that we have with ourselves on an ongoing basis. And then, so there's your internal environment, and you look at your external environment. So, you know, what and who are you surrounding yourself with every day can have a very healing or unhealing effect on you. So I have one small room that I call home right now. This is a fake background. But in my room, I have candles and I have incense and I have salt lamps and I have plants and I have pets and I have blankets and like everything and anything that I, as an individual, need to feel nurtured and feel like I'm in a healing environment. And I think that's something that we could go a long way in including in the institutional environment for our nurses as well, is looking at, you know, the environment that they are being surrounded in 8 to 12 hours and sometimes longer a shift. There is, you know, there's the aesthetics, there's the, you know, we need to keep everything sterile and clean, and everything has to be really easy to clean in a hospital environment to prevent infection, nosocomial infections. We understand that. But, you know, even when we look at this, a space, having a space for somebody to go just to decompress, even if it's for 3 minutes, right? Or you look at the staff room or the lunchroom, what can we do in that environment to make that a healing environment? Because a lot of people, a lot of nurses spend, you know, a good 45, anywhere from 45 minutes to an hour and a half, 2 hours a day in that environment, in the lunchroom. So what can we do to make that environment a more healing environment? Like, there's just so many different things that we can incorporate without having to try to find that extra time, right?
Yeah, it's about being creative, and nurses
Yeah.
are super creative.
Yeah,
You know,
absolutely.
And even if you don't, even if you don't get your full-on breaks during your 12-hour shift, which can happen,
Oh
you
yeah.
know, what can we do as individuals, you know, to have that meditative mindfulness moment throughout our shifts? And I wanted to mention something just really quickly, being mindful of the time. I heard just a really nice phrase that a colleague we were talking about bringing balance to our lives and that type of stuff. And she said, you know, it's not necessarily balance, because balance makes you feel like you really got to work at that and hold on to that. It's harmony. It's harmony that I'm going to strive for, because sometimes there's just nothing we can do about certain things, but can the rest of it be reconciled in a sort of a state of harmony? You know, I sort of like reaching out to that a little bit more than balance, at least right now. It struck me when she said that.
Yeah, that's interesting, because I just finished 8-week chakra course with Dr. Jelusich.
Yeah.
And when we talk about the chakras, we talk more about having harmony between them as opposed to balance, right? Like finding that place of harmony. Yeah. So it's interesting you bring.
Yeah, that's cool. So one last thing I wanted to just bring up for now, and I'm just loving this conversation, and I think that we should be doing this more frequently in the next year on topics, even going beyond, getting into chakras, getting into, you know, energy work, getting into different types of ways that nurses can use holistic practices, those types of things that are practical and usable, especially as people are learning. But people always ask, is a holistic nurse a regulated nurse? That's a big one. Is a holistic nurse a regulated nurse?
Absolutely.
Yes, we are. So a holistically informed nurse, yes, you can practice and practice well and be regulated. Be able to call yourself an RN.
Oh,
every province is different. We know about that, right? Yeah.
Yeah. I really, like, in my experience in talking to the different provinces about our program in holistic nursing and nurse coaching, I haven't come up across any that would debate that nurses are holistic practitioners. I think it's more you know, if you are a holistic nurse who has a particular interest in, or you have an interest in a particular holistic or complementary modality, that you make sure that you know, you can substantiate using that within your toolbox, and that you have the credentials to use it, and that you use it within the nursing process.
Right. And the nursing process is the big key.
It
And your
really is,
and
yeah.
your standards of practice.
In standards of practice,
Yeah.
yeah. Like even Reiki, when I spoke with my regulatory body in the province I lived in before, when I first asked about practicing Reiki, the initial response I got was no. So I ended up going back to them after the fact, and I brought in the nursing research on, you know, energy and being energy beings, and the nurses that had created healing touch and therapeutic touch and all of that. And it was like, I really don't understand why I can't do this. And so I think, you know, they weren't ready for that question either at the time, because it's all new, or it's, you know, it was at the time. But where it ended up landing was absolutely you can do that, but you can't just do that, because anybody can just do Reiki, right? If you want to use it within your nursing practice, you need to have that assessment piece, you need to have that follow-up piece, that planning piece. So yeah, which just adds richness to what we're offering.
Kim, did you want to say something?
Nope.
No, you're good. Okay. Thanks for that, Sherry. Yeah, it's all about incorporating what we do to make it a nursing task, you know, a nursing specialty, a nursing practice. So, but, you know, we have these conversations, we are educating other nurses around this. So we are more than happy to take your questions, your emails, have you participate in any more of these webinars. So keep an eye on our website, because I'll be posting the schedule up until April, I think, for 2023. And we would really like to hear from you. What do you want us to do? We're going to listen to you guys. You know, this is your CHNA, and we are more than happy to connect with you. So yeah, so I'd just really like to thank everybody who was here today and taking the time. Wish you all the best of the season, and hope you have a good rest of your days. Take care.
Thank you, everyone. Merry Christmas.
Bye, everybody. Merry Christmas. Happy New Year.
You too.